Now we've got Eamon Shanahan here in studio with us as always. Great to see you,
Deirdre,
Eamon.
how are you?
And delighted particularly to welcome back Dr. Alan Mulgrew, who is a consultant respiratory physician at the Bonds here in Tralee. Alan was with us just a few weeks ago. We had a huge postbag, you might say, of questions for Alan, so he very kindly agreed to come back and speak to us again. And Alan, thank you so much for giving up your time. Eamon, you might explain to the listeners what exactly it is we're going to talk about.
Okay, so the concept is a slightly medical term, is called herd immunity. Now, the concept behind that, it's the level of immunity that there is in a group of people. And it's particularly topical at the moment because herd immunity is probably a bit down. So normally what happens is that in normal times, as we go through the cycle from year to year, people are exposed to a variety of viral and bacterial infections, but particularly the viral infections. And over the course of time, people build up an immunity to that virus. The immunity that people has either wanes over time, that's true over decades, or if they don't get exposed to new viruses, then they don't have the immunity to those viruses. And of course, that was exactly the problem with COVID, because nobody ever in the world had been exposed to COVID before, so that's the reason why everybody got COVID. Part of the very appropriate measures that were taken to manage COVID and to flatten the curve, if you remember that, so as to try to minimise the number of having a total catastrophe, was that people isolated, with the effect that 2 years ago, so the winter of 2020, as general practitioners, we were seeing nobody with coughs and colds because everybody was isolating, which goes to prove that social isolation really, really does work. The difficulty, I suppose, is that it's not a difficulty, it's just a reality that during that period of time, particularly for small children, but for other people in society, their immunity may have waned slightly. So right now, this minute, we're seeing lots of people, mostly children, but adults and particularly older people as well too. So every virus is happening all together at the same time. So we're seeing lots of people with respiratory tract infections and other infections. This will pass. It's just the way it is this year. So we're, as I've said a couple of times here before, we're back to 2019 in that respect. So that's the concept behind herd immunity.
And Alan, because the respiratory system is your area of expertise, I presume that it's peak time of year for you, is it?
Yeah, and as Eamon says, we're back to business as usual. But it's certainly in the time since I was last in, which was only a few weeks. We've significantly increased the amount of viral illness we'll see. But the problem for my bunch of patients, who all are vulnerable and all have bad chests to begin with, is that these acute viral illnesses will tend to exacerbate their underlying processes. So for 2 years now, I haven't been seeing people coming into hospital exacerbating their COPD or with their asthma at anything like the previous frequency. Now, not only are we seeing at the previous frequency, we're probably going to see more of it. And, at the moment in the hospital, we have, we've got flu. I've our first flu in yesterday. We've got COVID in, we've got RSV in, and then, a week after those things, you may get a bacterial infection. So I'm expecting it to be a busy winter from a respiratory perspective.
Yeah, the signs are there. And it must be difficult, I suppose, perhaps for the GP to ascertain, because the symptoms for all of those conditions you mentioned are similar. Yeah.
The only thing, and I think we've said this a couple of times before, and if you remember when Dr. Lee, who was on with us a couple of months ago now at this stage, the point I was making is I differentiate, at least in children, between the well child, the sick child, and the ill child. So nearly coming in the door, I have a reasonably good idea of what the child is going to be like. You've got the child who's croth and fractious and cranky and miserable and wants to claw my eyes out and doesn't want me to examine them. I'm not really worried about them. I'm worried about the kids who don't want to fight me, who are just lying quietly in their parents' arms. Likewise, if you've got an older person who is just ill, who's sick in themselves, in other words, it's almost a feel, if you like. Now, there are obviously measurements we can make as well too, but to a certain extent, it doesn't almost matter what people come into us with, as long as they're okay. It's when they're not okay, that's where the problem, and that's when we refer them on to our hospital colleagues.
Okay, and it's a tricky one for a GP as well to know when somebody has just tipped over into that stage where...
Yeah, I think the phrase we use all my trainees will be well aware of this, the concept of safety netting. So the idea that the person has a pathway back to the general practitioner, that in the event of things deteriorating, that there are plans. It's not just a case of here's the antibiotic, away you go. It's here's the antibiotic, but if you find there's no change, or if you find you're getting worse, get back to me again, and then we make the change.
And then you make the change, yeah. And of course, Alan, we're hearing about a shortage of antibiotics, and that's probably making life more difficult as well.
Yeah, I mean, thankfully we have lots of substitutions for our antibiotics, but I think, you know, this is one of the unforeseen consequences of Brexit, is that an awful lot of our medical supply chain does come through the UK, and now that they're not part of the EU, they can actually blockade or embargo what's supplied. So ironically, even if drugs are manufactured in Ireland for a UK base, we may not be able to get them back. So we don't have a huge problem at the moment. Haven't seen, but yeah, we would anticipate this is going to be yet another challenge for the health service in the new year.
I think one of the points I'd make there is that it remains the case, and it's still very much the case, that we must be rational in our use of antibiotics. Yes, we probably will end up prescribing slightly more than before, but we can't. I think one of the things we need to watch out for is the concept that, if I keep taking an antibiotic, I'll not get sick. And the answer is that it doesn't work like that. In fact, all you end up doing is developing a resistance to the antibiotic, and to quote the famous ad, when they're gone, they're gone. And that's a huge worry. And so the thing is that despite all that's going on, we still have to be sensible about how we prescribe and use our antibiotics, because they are a finite resource.
Just to come back, Alan, to the whole idea of herd immunity, and Eamon mentioned there that nobody got coughs and colds when we were all isolated and wearing masks and away from each other, and there was no parties or anything like that. But I suppose realistically, life has gone back to normal now, and there's lots of gatherings over Christmas. So does that mean that people with conditions like COPD and asthma and some of the other ones, other conditions you mentioned, that they still need to isolate at this time of year? Because that sounds harsh.
That's not the inference. I think you know it's great that we're all back. I mean, that all of that isolation wasn't any fun, and a lot of people lost an awful lot of. And again, bearing in mind that not everyone has an abundance of good years out there, then of course we want everyone to socialise. I mean, what I would say is if there are preventable things that can be done, like if you haven't had your flu vaccine and you're thinking about it, well, maybe go get it. If you hadn't had your pneumonia vaccine and you hit criteria for a pneumonia vaccine, then maybe you should get it. I mean, that's something that can be done. And again, I know we're all fed up of getting vaccines and talking about them and don't like them. But the reality is that if anyone's ever been knocked out by a significant influenza, it's not a fun illness. And every year, long before COVID, I put patients on ventilators because of influenza. And that's coming again. We didn't see a lot of flu in the last 2 years. And I suppose the issue with the herd immunity is that if I'm immune to flu and I meet someone on the street with flu, I don't get it, and I don't give it to you when I come in to speak to you. But if I amn't immune to flu and I meet someone on the street, then I may catch that flu and bring it into you. So the more people that are out there that are immune, the less the virus spreads through the community. And that's the whole concept of vaccines. Vaccines are not perfect. They don't always prevent the illness, but they almost always make the illness less severe. And, so those folk who fit criteria for flu vaccination, who haven't had their flu vaccine yet, well, there's flu out. We've seen it. I diagnosed it this morning. So that's not an illness that you necessarily want to have.
We're always hearing about different variations of the flu, and I know there was some of the variations come from Australia, don't they? Or they start out in Australia. The flu that you're seeing at the moment, albeit in the early stages, what are the typical?
Yeah, it's an influenza A, and the concept of the Australia thing is it's what happens is the Australians have their winter before we do. So what happens in Australia during our summer will tend to reflect what happens during our winter. It's not necessarily that the Australians have a special flu factory. It's just that they hit winter first, and influenza tends to be that seasonal thing. So what we do is we create a vaccine each year that reflects the prevalent flu of the last year. So far, we haven't seen, what we've got is a typical flu A, and the vaccine that's out there would be appropriate for what we've seen so far.
Okay, and what kind of symptoms is it presenting with?
Fever, and I think, typically flu will start with a fever, sore throat, headache, aches and pains, and then it evolves. And the problem with influenza is that it'll evolve into, chestiness and wheeziness, and there's quite a long prodrome there's quite a long aftermath. And the difficulty is that the sort of temptation is to get in with antibiotics early, at a stage probably earlier in the illness where they won't do much, and then a week or two later when they may be more appropriate because there may be bacteria getting involved as part of the course of the illness. If you've already had one or two antibiotics that haven't worked, now you're full of antibiotic chemicals, and the third time you're getting sick from an antibiotic. So if everyone in the house has a viral illness and they're all snuffly and all have fevers, then probably an antibiotic's not going to help at all in the first phase of that. If people start developing cough and phlegm and it's discoloured and that's not getting better, that's when an antibiotic can be useful.
Yeah.
Okay. Eamon, we're asked every week, you're asked every week, similar questions in various guises about our immune systems and building up our immune systems, and how come Alan might have the flu at the moment and you get it off him but I don't, but we've both been close contacts. Why do some of us seem to have a stronger immune system?
And if somebody knew the answer to that, I think we'd have the answer to many of medical problems. The reality is, I think it's kind of seed and soil, and what I mean to say about that is that a specific strain of virus is in circulation, and some people will succumb to it and other people won't, and that may well be down to individual innate parts of their immune system. The problem is that the immune system is an extraordinarily powerful thing, and you go messing with it at your peril. And the reality is that if you try to modulate somebody's immune system, there is the potential for really bad things to happen. So unfortunately, the good thing is that for the vast majority of people, fortunately, the immune system actually works very well. As I keep saying, if you've got a child who's cranky, invisible and cross and they're running a temperature, that's actually their immune system working. So that's the bit I don't fear. What I do fear is the very quiet child, the very, very subdued child, and they're the things I worry about.
But having said all that, though, I guess there are some things we can do, because I think we all sort of accept that if you're not eating properly, exercising, out partying every night of the week, smoking cigarettes, whatever, you are going to pick things up more easily.
Well, there are things. I mean, you hit very much the nail on the head. Smoking is a significant problem because it does have an effect right throughout the body, including in the immune system. Excess alcohol isn't great either. Being generally fit and healthy is a good thing. All right, it helps with quality of life. It helps with quantity of life too. Yes, it makes sense.
Okay.
Yeah, I'm going to give a shout out to the runner this morning. He was boosting his immune system, and he's going to argue that he was going to run in the dark this morning, or he was going to run in the dark this evening. But if he's training and he likes running, he's going to run in the dark. So sleep, really important. There's no question that if you don't get enough sleep, it's bad for immunity. Diet is important, especially sort of vitamins, and we want unprocessed food, not processed foods. So that's clearly important and essential. Exercise is important, and one of the things I'm blue in the face saying to my respiratory patients is that exercise isn't just important in terms of their muscles. It's important in terms of actually aerating their small airways. So if folk aren't robustly exercising and taking deep breaths from time to time during the day, I'd always be encouraging a sort of, breathing exercise program. You've got to open your small airways. You've got to clear out the mucus. Eamon, I'm sure, has the experience that when you examine a patient in your surgery and ask them to take deep breaths, when you're listening with the stethoscope, invariably you'll induce cough. They'll start coughing because they haven't taken those deep breaths all day. So that's one of the sort of respiratory health things that's worth emphasising. If you got a whole load of phlegm down in your airways, you want it out. You want to cough it out. You don't want it sitting down there.
Exactly. Please do send in any questions you might have for either of our doctors. 066 712 3666. Eamon, we've a listener in their 90s who says they're getting a pain through their head at either side at the moment. wondering what it might be.
Yeah, 90-year-olds with headaches would be a bit of a concern. It's like any new symptom in an older person. One of the things I'd wonder about, there is a thing called temporal arteritis, TEMPORAL. It's an inflammation of an artery in the side of the temple. There is a simple blood test your GP can do for you to determine whether you've got this temporal arteritis thing or not. The significance of it is that there's a branch of the of that artery. It's literally in the side of your head, but there's a branch of it that goes into the back of the eye, and it provides the eye with its blood supply. And if you get an inflammation of the artery that causes a blockage of the blood supply to that blood vessel that supplies blood to the back of the eye, you can get instant and irreversible loss of vision. I've had one or two people who are sadly and tragically, they've come to say, Doc, I couldn't seem to see out my eye last night, and there was no pain or anything, I just couldn't see out my eye, and we sent them in, and unfortunately it's too late. The thing is that if there's any, that's the reason why we would screen for the temporal arteritis thing, is that we get in with the appropriate treatment to prevent that kind of catastrophe happening. Other than that, I suppose there'd be other things that could cause headaches, but that's probably the first thing that would come to mind.
We've a question from a parent who has a 7-year-old with chickenpox at the moment, first noticed on Sunday. The parent is wondering, when will she be okay to be around children again? Her Christmas show is on this Friday. Will she be able to go?
Okay, so I think that the traditional advice had been is that when the crops stop appearing, so the idea behind the crops, exactly. So what that's about is that you see a crop of spots. In order to see you see a group of spots, and then you look back maybe an hour or two later, and there's another group of spots. And when the the new spots stop appearing, the child is no longer contagious. That's the argument.
So if today's Wednesday, so if the spots appeared last Sunday,
yeah, but it's when they stop, when new spots stop appearing.
Okay.
There'll be old spots there,
yeah.
But as long as she's not developing new spots, then she's no longer contagious.
The crops will tend to be blisters, vesicles initially, and then they kind of crust over.
Yeah.
And so it's when everything there has crusted and there's nothing new.
Yeah.
That's lovely.
That's lovely.
Yeah.
Enjoy your lunch, folks.
Well, interestingly, just if I might for 1 second, there's an aside. In the not too distant future, I hope to see that we'll have a chickenpox vaccine. And the rationale for that is not so much to protect the kids from chickenpox, which is a nuisance and inconvenience. It's that Alan and myself both see and have had to deal with the consequences of adult shingles, which comes from the chickenpox virus. And the problem is that particularly in older people, you can get this very horrible condition called post-herpetic neuralgia. It's a nerve pain and neuralgia that people get where they had the shingles, and it's something that can really destroy the person's quality of life. So there are varicella zoster virus vaccines available for older people, but what I'd hope to see, as in other jurisdictions, that we would actually start vaccinating children for chickenpox. Again, I think the thing is that there are a handful of children who are otherwise compromised, whose health is not great for other reasons, and they get chickenpox, and it can be life-threatening to them. So it's part of the reason why we should try and vaccinate for that as well.
But in addition, I mean, we lived in Canada, and it was routinely done in Canada, the chickenpox vaccine, and having had one child sick at home with chickenpox with both parents trying to work, so that's a week off work. It's very stressful, very difficult when when you're under work pressure. All of the rest of our children have had chickenpox vaccine, and they never had chickenpox, and we never had to take a week off work, which is, I suppose, we'll say that's an advantage.
Absolutely. Listener says, all the radio stations are constantly, every day, telling pregnant women to get vaccinated for COVID, but the figures are showing that only 5% of pregnant women are getting the vaccine. They're clearly afraid of the implications. No one can tell them for sure it'll be okay. And that's for sure, as the vaccines are new. What does Eamon think?
Okay, so if we go back to the start of COVID, one of the things that the obstetricians in particular observed was it was a placentaitis, I think was the thing that was happening, that women who developed COVID, who were pregnant, they developed an inflammation of the placenta, which led to catastrophic obstetric outcomes. My recollection is that the bigger maternity hospitals in Dublin, the Rotunda and so on, they were having large numbers of very seriously ill women who had COVID, and there was a bump in a rise in the number of deaths and perinatal deaths and all sorts of horrible things happening. So that's the reason why. Now, I understand that people have reservations about vaccinations. I accept all of that. And we are encouraging, I mean, as we had spoken about it earlier, influenza vaccine, we do routinely offer influenza vaccine and whooping cough vaccine to pregnant mothers as well, because pregnant mothers, because of the changes, this is my personal view, changes to their immune system because of pregnancy, seem to be more susceptible to bad things happening to them and to their babies if they get these infections.
Yeah. Another question from Margaret, and this is specifically for you, Alan. She says she's a child of almost 2 that's constantly getting infections, chest, ear and throat, no sooner out of one than there's another. Is there something Alan would recommend that would help build up his immune system? Well, I suppose he's at that age where he's going to pick up everything, I guess.
Yeah, and of course there's also the potential that this is an allergic process rather than an ongoing infectious process, and there may be sort of a sinus adenoids type thing. So I think for the majority out there, rolling infections are not related to a poor immune system. It's much more likely that you see frequent respiratory infections because of an overactive immune system. And that would always be my question. Is this an allergic process if you keep getting the same syndrome again and again and again?
And how would you get that tested?
In a 2-year-old, harder, and Eamon knows more about this than I do because I don't do kids. But you certainly a trial of therapy, Eamon.
Yeah,
do you think?
that's what tends to happen. That's what the guidelines are. I don't like sticking needles in children if we can avoid it. There is a particular blood test, called a RAS test, which is a not specific test. It gives a guide, but not a specific test, and that's really the only test. Sometimes, if you've got a child who has recurring cough and especially wheeze, we might use the appropriate treatment. There are a number of things you could use, a steroid inhaler, even though it's difficult to try and get that in a child. I tend to use a lot of a medication called Montelukast, which is licensed from about 2 years upwards. It's a non-steroid, non-antihistamine allergy medication, can be very effective. So it depends on the child and their presentation.
Okay, unfortunately we're going to have to wrap up, folks, but I might just put the last question to Alan because we mightn't see you again for another few months, so we might as well. Just as a general rule, if there's one takeaway message to get out there as we head into the Christmas season, we're going to have generations mixing, grandparents, grandchildren and all that. Would you say, I'm predicting what you might say, would you say to grandparents, if you are going to be mixing with your school-going grandchildren, make sure you have your vaccines? Is that the...
I think, yeah, be vaccinated. If people within the family clearly have viral illness, so if they are, sick with temperatures and sneezing and unwell, more than a little bit of a snuffle and a cold, and there is a vulnerable person thinking about visiting, well, think about that. Not don't have your Christmas dinner with the family. Just a little bit sensible, and bearing in mind that we're all fed up of wearing masks as well. If you think you've got something catching and you wear a mask, it's unlikely that you will transmit that illness to someone else.
Yeah, okay, that's a sensible takeaway message, I think. Alan, thank you so much for coming into studio to join us this afternoon. Thanks also to Dr. Eamon Shanahan.